Hi, everyone. Thanks for joining today's webinar, Healthcare on the Move, Telehealth in the Transportation Industry, with our speakers, Suzy Baker and Ian Colton. We have a ton of information to share today. Just a bit of housekeeping. If you have any questions during the webinar, please enter them in the question section. We'll answer all questions at the end of the webinar as time allows. There's also a handout section where you can download content for a deeper dive into our solutions. I want to remind everyone that today's webinar will be recorded and will be sent to all participants tomorrow. Now about our speakers. Suzy has been in the workers' compensation industry for over 15 years, starting on the employer side in the healthcare and aggregate industries. She has been with the Alabama Trucking Association Comp Fund Alliance Interstate Risk since 2019 and serves as a director of claims, overseeing the teams of adjusters handling claims for all their fund members and insureds. ATA Air has been offering Medcall advisors telehealth services as part of their comprehensive claim management program since 2020. Ian has been with Medcall since 2019 when he started as an intake coordinator. Through his tenure, he has worn many hats and now serves as the business development manager. During his time at Medcall, he has been able to witness the transformation of relationships, of technology, and healthcare. Let's go to a poll question. All right, so really quick, we want to have everyone kind of tell us what exactly field you're in. So if you're in the field of transportation, what mostly aligns to your field? So we'll take a minute and let you fill this out. Okay, so I'm gonna close the poll. Thank you everyone who was able to fill the poll out. Thank you for that. And now I'm gonna hand it over to Ian. So Ian, take it away.
Thank you very much, Sean. And thank you everyone for joining us today. I'm gonna go ahead and just hop right into this. All right, so as we all know, workplace incidents happen. Most employers have a reporting process that looks very similar to this. The injury occurs. The injured employee seeks medical attention at the nearest urgent care or emergency room. Now, often the physicians at these locations lack work comp knowledge and experience. Oftentimes, they may recommend unnecessary time out of work or even refer the injured worker back to their primary care physicians. Now, following the treatment, the claim is reported and then it gets set up. Now, note the time lost. There's the travel time to the urgent care or emergency room. There's time spent in the waiting room, travel time back to the website, reporting time to the supervisor or HR, and then that report has to be transferred to the insurer. If the employee is instructed to take time out of work, there may be a longer wait time before the employer gets the report. Alternatively, the employee is reluctant to waste all of that time and then the injury gets left untreated and the report time is delayed even further. But now that they've delayed the treatment, they still have to complete all of the steps that we've just looked at. As reporting lag time increases, the likelihood for litigated and indemnity claims rises, and by extension, claim costs go up. Now, physicians that work for telehealth programs, such as Medcalls, appreciate the guidance around employer, state, and workers' comp rules. They know how to handle workplace injuries. Next slide, please. Now, the transportation industry faces unique challenges in regards to workplace injuries. Over-the-road drivers are often at a disadvantage as healthcare access can be difficult. If a driver slips and injures their knee at a truck stop in a rural area in the middle of the night, there's no direction for care. Because of the inability to access that care, the injury may go unreported or reported days, even weeks after the incident occurs. The details of the accident may be lost, and most importantly, the health and well-being of the driver is compromised. Suzy, what do you hear from your members at ATA and Air?
Hey, yeah, thanks, Ian. Well, certainly the biggest challenges that we're hearing and that we see in the industry relates to our over-the-road truck drivers and where they're able to find that appropriate medical care following those superficial kind of sprain, strain injuries when they're away from their home state. This really was the whole reason that we sought to partner with Medcall. They were a company that were developed to provide this service specifically for the trucking and transportation industry. So what we were finding is that drivers were defaulting to go to an emergency room following an injury, even though it wasn't a true medical emergency type injury. Because of that, the care that they received wasn't really appropriate. They were doing full diagnostic testing and scans of their whole body. They were written prescriptions and then told, to be written out of work for several days and then follow up with an occupational care doctor when they got back home. So we needed to be able to find some kind of a solution to offer to our member companies.
All right, so a great way to provide that immediate access to healthcare is telehealth. Now, as you all may know, telehealth is a modern solution to an age-old problem. Healthcare access at your fingertips. Through the use of technology, people can have a nurse, a physician's assistant, as close to them as they would have a cell phone. It's become very popular. In 2021, the CDC published a statistic to show that 37% of all adults had utilized a telehealth program within the previous 12 months. The workforce is becoming increasingly more comfortable with the use of technology for their healthcare. Suzy, how does ATA view healthcare?
Yeah, so as we mentioned, it's obviously a good solution for those over-the-road truck drivers, but the more companies that we are onboarding to this program, we're finding that other business models are benefiting from it as well, including local or regional moving companies, and even folks who just have local routes can even find a use for using telemedicine. Again, these are for non-emergency type injuries and claims. So, the biggest benefit for us was it allows that access to drivers to that board certified physician who not only has emergency care experience, but they're also familiar with occupational health. That goes on to include, OSHA familiarity, DOT, significance of lost time days in the workers' compensation world, significance of writing prescriptions or seeking diagnostic testing. And then, of course, the obvious one, it provides immediate options for them for medical care.
Now, this is just a quick list of the benefits everyone reaps from telehealth access. Simply put, following any injury, the safest, most effective, and efficient thing to do is seek immediate medical attention. Telehealth expands access, lowers costs, caters to individuals, and it improves outcomes. Suzy, can you tell us about some of the benefits that you have experienced using a telehealth program?
Sure. So our folks are seeing that obviously the immediate access to medical care is going to be first and foremost, but we're also finding that it's kind of a good option to be able to offer when an injured worker is kind of unsure if an in-person appointment is necessary. In a majority of the times, we're finding that the telehealth doctors are able to give any sort of self-care or self-treatment recommendations. Rarely are we seeing any lost time days beyond the state waiting period. And in most circumstances, we can usually avoid that in-person office visit altogether. They're able to get the treatment recommendations that they need through that telehealth appointment, and they're not even having to follow up with a doctor in person when they get back to their home base. In terms of like a tangible cost savings, Medcall offers contracted flat fee rates, which are certainly less than what we're paying for in-person office visits. So we've got some soft savings and some hard savings as well there.
So if we go ahead and we circle back to the challenges that we face in the transportation industry specifically, look at how well the advantages of telehealth line up. Workers gain immediate access to healthcare anywhere and anytime. Experienced telehealth physicians cut down on that travel and triage time compared to the brick and mortar providers. Workers are able to receive the appropriate level of care within state and employer guidelines. As Suzy had mentioned, sometimes injured drivers are recommended to take time off of work or given extensive restrictions or extensive testing is ordered. Employers and insurance providers are able to rest assured that the worker will not be pushed through a series of these unnecessary tests, follow-ups, and physical therapy sessions that often occur with urgent cares. You're able to avoid the high costs and long wait times of emergency rooms. Suzy, if you would, could you tell us about some of the benefits that you've experienced through the use of telehealth programs?
Yeah, we see this all the time. In fact, this is probably the most common scenario of the users that we have making these calls. But we have a driver who may be over the road or on a job site. They feel a shoulder pull or a back tweak or twist their knee, something along those lines. Again, this is for those kind of superficial strain sprain injuries. They notify their employer immediately. They're not really sure if they feel like they need to go for an in-person medical visit, but they're also unsure if they feel safe enough to continue on their trip. When those drivers are referred to telemed, they're able to speak with the telemed doc. The doctor listens to their symptoms, makes treatment recommendations, and then most importantly, is able to give the driver the confidence to be able to continue on their trip without issue. That's not to say that they may not require an in-person office visit when they get back to their home base, but it kept that driver from going to the emergency room unnecessarily, and then the possibility of not finishing out their trip in a timely way.
All right, so we have so far reviewed the current workplace injury reporting process. Now, let's take a look at the flow when you introduce a telehealth program such as Medcall. Following the injury, the employee calls Medcall and reports the incident. As the injured worker recounts the incident, a trained intake specialist is documenting the incident, all while identifying a board-certified ER physician to connect in real time for triage. The injured party has effectively reported the incident, obtained medical attention, and been directed on the next steps in a 10 or 15-minute phone call. Now the claim can be created and the employee can return to work knowing that everything that they need to do has been handled. Medcall compiles information such as date and time of injury, cause of the injury, days of the week most injuries occur, and more things such as that. Now, with all this real-time data captured, it gives insurance providers and employers the opportunity to manage and lower their risk by understanding injury trends in the workplace. Suzy, why does ATA and AIR use telehealth, and why is it important for them?
Yeah, so we've talked about some of those benefits already, but there are a couple of things I really want to focus on here and emphasize to the audience that we really haven't spoken much about. And you touched on it here a little bit with your data collection. So the first item is everyone needs to know that following a telemedicine phone call, an intake report is created by the folks at Medcall, and that is emailed usually within 30 minutes to an hour of the end of that phone call. It's emailed to both the employer contact and to your carrier if that's the way that your program is set up. In terms of how that is advantageous to the employer, is that can serve as a first report of injury. So we're now saving time for the employer or the safety manager, who no longer now has to take the time to complete that first report of injury before getting it reported to the carrier or your TPA for handling. That's item number one. Item number two is that when those calls come in, every one of them are recorded, and those calls are saved. I think it's a minimum of 7 years. And you can confirm that during the slides, but that is infinitely helpful. We've had many instances where once an adjuster has gotten a hold of a claim and is doing their recorded statement as part of their standard investigation of a claim, something may just not seem right. There may be some red flags, and it's really helpful to be able to pull that audio call from the telehealth line to make sure that what they've given in their recorded statement is the same thing that they've reported to the physician, and also the same information they've given to their employer when they notify them of the injury initially. If at any time those stories don't align, of course, that can change the course of the investigation, just gives the adjuster pause, and they want to make sure that they're crossing all their T's and dotting all their I's.
Now, at this point, you may be asking yourself, who is Medcall? Now, originally, as Suzy had mentioned, Medcall was founded to address the lack of healthcare access in the transportation industry, specifically for over-the-road truck drivers. Medcall uses only board-certified ER physicians with a working knowledge of occupational medicine. Our physician team understands the nuances of workplace injuries, work comp, and the employee's desire to return to work. We build a program that not only prioritizes the health and well-being of employees, but also shows efficient resolution at a reduced cost. Now, with all of the data that we capture, when we make use of it, we show that we've been able to do things such as avoid in-person visits 78% of the time. 72% of the time, injured workers are cleared to return to work at full or limited duty. We also have data showing the number one cause of workplace injuries are slips, trips, and falls. And all of this information is accessible through a client self-service portal. And Suzy, you were absolutely correct. All of this information is captured and archived for 7 years, and it's available to all of our clients to access at any time. And that does include the reports as well as the audio recordings and the visit between the employee and the physician. Then the next slide, I'm going to go ahead and hand the reins off to Suzy and let her tell you about ATA and Alliance Interstate Risk. Suzy?
Thanks, Ian. Guys, there's a lot of really good information on this slide for you to review. I really just want to give you a couple of takeaways that I'd like for you to remember as to what makes the ATA and AIR different. Number one, we're putting our member companies first and foremost. We've been in this business this is our 30th year. Our motto has always been by truckers for truckers, and that is the way that we operate. Secondly, we have a board. All of our members are made up of representatives from various motor carriers, and these are people just like you. These are owners, these are safety professionals, these are CFOs, all people who have a vested interest in the transportation and trucking industry. And then finally, and this may be the most important, all of our profits are returned to member companies in the form of a dividend. And in fact, our historical average is about 26% annually. And candidly, I'll tell you that the last several years, it's been even higher than that. We've got some contact information listed there at the bottom of this slide. If you'd like to learn more about our program, feel free to shoot us an email at that marketing@atacompfund.org email address, or contact your insurance agent to get more information. I saw that we had several of our current member companies participating on the line. Welcome, and thanks for joining us today. Any of those who are interested in enrolling in the telemed service as part of your claims management program, just contact me or your risk manager in order to enroll.
All right, so thank you, Suzy. Thank you, Ian. We're going to go to Q&A at this point. Just a reminder, if you have any questions, go to the questions section of the menu, and you can add your questions there. So I'm going to go into this and see what questions we have. This looks like it's for Suzy. Suzy, the question is, please walk me through how this works. If I'm an injured worker making the call, what can I expect?
Yeah, great question. Thank you for that. So it's been our experience that when an injured worker notifies their employer that they've had an injury and that that they are seeking medical attention, and in person may not be the right option for them at the time, the employer or the safety personnel is giving the Medcall number to the injured worker. They're calling. They will initially be connected with an intake operator who's gathering some information like the meat and potatoes, the who, what, when, where, and why, information about what happened with the accident and what the body parts injured, etc. At the completion of that portion of the call, they are connected with a board-certified physician. When that physician joins the line, then the conversation really mirrors exactly what it would be if it were an in-person visit. Tell me about what happened, what are your symptoms, this and that and the other. And then at the conclusion, treatment recommendations are made, and there's discussion, making sure that the patient understands what's being recommended and what their next steps are. As I mentioned earlier, at the conclusion of the call, that written intake report is sent via email both to the carrier in our case and also to the employer, so everyone has the same information and we're all on the same page as to what kind of treatment recommendations have been recommended.
Okay, thank you, Suzy. Next question, Ian, maybe you can start this off, maybe if Suzy wants to add some flavor. Here's a question. Have you or your organization faced any specific challenges in managing workers' compensation cases in the transportation industry?
It's another really good question. The most common challenges just in the transportation industry are the geographical challenges with over-the-road drivers. They do find themselves in different parts of the country, sometimes rural areas at different times of the day, and that's when they may experience their injuries. Communicating with them and coordinating that treatment becomes difficult sometimes if they do have to be seen in person. If it's not reported in a timely fashion, some of the details might get lost. If they do have a load that they have to leave, unfortunately, returning to work, planning out that returning to work can sometimes be difficult. And then unfortunately, if they do get into that emergency room, managing the cost of those visits is very difficult sometimes. So, those are just the general issues that I do see come up all the time.
Okay. Hey, Ian, if I may, those are all very good points. A little bit more specifically, and I know that we've talked a lot about over-the-road truck drivers, and we've touched a little bit on these moving companies. But something that we kind of saw as an additional benefit that we weren't expecting as we had more and more of these moving companies join. Think about if you've got these, regional or even local moves, and it's a very highly constructed number of people who are assigned to each of those moves. If you've got somebody who's injured while they're, loading or unloading someone for a move, it's really detrimental for them if they've got to pull somebody off that job to send them out. They're going to lose half a day or a full day for that injured worker just to be able to have them seen by somebody. In the opportunity with telemedicine, what we're seeing our folks doing, that injured worker is notifying the employer of the injury, and then they're either hopping into the cab of the truck to make the phone call to telemedicine, or stepping around side of the residence or the apartment or whatever, to talk to the telemed doctors, and then they can jump right back in. And so we're virtually not losing any productive time. We're not having to try to find new folks to cover for the person while they're away. So that's sort of an added benefit that we had not considered when we first started working with Medcall for telemedicine services.
Okay, thank you.
That's a great additional point.
Oh, no, you're good, Ian. Okay, I have another question. Ian, this looks like it's probably specific for you. What would you say are the key factors to consider when evaluating potential benefits and implementation of telehealth?
That's a good question. These are very professional questions, I'd say. Let me just note that. What I would say is that some of the key factors are going to be, one, the accessibility and connectivity. Are people able to use this? That's going to be the most important factor, right? Like, is my team going to be able to utilize this service? And that kind of that lends itself to the next point, the scope of services, right? Are these services right for me? Do I often find myself plagued with these challenges that occur so frequently with these moving companies, over-the-road companies? Is this something that is going to benefit me and my team? Now, something else you might want to consider, the data security and privacy. We're dealing with physician visits and PHI. Is this information going to be secure and safe for the people using it? Are we getting a return on investment? Like, is this a cost-effective program? And that goes with most programs that are launched for a company. Is this something that's going to be worth it for us? With telemedicine, you're saving money over a traditional visit, and you're prioritizing the health and safety of your team. And then something else that might come up is employee acceptance and training. This is going to fall into that accessibility for the team. Are people going to know how to use it? And I would say with Medcall specifically, if you know how to use a cell phone and you know how to tell somebody what hurts, then you'd be able to use this. That's about the long and short of the training there. And then just integrating it into your system. So making sure that your employees know when they're injured, hey boss, hey supervisor, I did just get hurt. I'm going to call Medcall and talk to a doctor, and they can let me know what the next steps are.
All right, thank you,
Ian. Ian, that's really well put. I've got one other thing to add to that. Sorry, Sean.
Go right ahead.
I get that question from time to time when I'm talking with some of our member companies about utilizing this service, and the question comes up, how do I present this to them? If they've been used to telling me that they've been hurt and now they're expecting to go physically to a doctor's office, like how do I sort of get over that? To me, it's all in, number one, a culture change, but it's also in how it's presented. So if an injured worker has called you, let you know that they've been injured and they're seeking medical attention, and you feel like this is something that is more of a superficial thing, an in-person visit may not be necessary at this time, present it in a way that says, okay, great, we utilize a telemedicine program for our workers' comp injuries. Here is the phone number, call this number, and you can speak with a physician about your injuries, and they'll give you some recommendations for treatment. If you present it as, well, we have telehealth. Do you want to use that? 9 times out of 10, they're not going to opt for that just because they have more of a comfort level of an expectation of going to a doctor's visit. So it's a bit a shift in how you're presenting that, and also just getting everybody on board with that culture change.
All right, thank you, Suzy. Suzy, this looks like a question for you. This is a little bit lengthy here. So can this be used for employees who are not drivers as well? Elaborating, if I have employees who would like to use this, not as workers' comp, but as a telehealth, is that possible? Can this be an all-inclusive benefit that we can offer our employees?
That's a wonderful question, and it's something that I always talk about right off the bat when I'm onboarding new member companies. Okay, several parts. Number one, yes, it can be used for people who are not drivers, and we have people in our membership who use it for any and all employees where it's appropriate. Number two, this is specifically geared and intended for workers' compensation injuries. If you have a telehealth option under your personal health plan, then that would be, you would need to route them to those other phone numbers or carriers to access medical care for personal related injuries. One thing I want to touch on, my biggest thing when I'm talking to people about how they're to use this and implement it, rather than just giving every employee the phone number and says, hey, if you have a work comp injury, call telehealth. I, having been on the employer side of things, I always like to sort of maintain that control. I wanted to know, first of all, when I had somebody who had been injured on the job and they were seeking medical care, and then I wanted to be able to know where they were going to seek that care so that it was the appropriate place. How this helps employers in this scenario is it keeps people from calling that telehealth number for personal medical reasons. You're only going to refer them to this Medcall number for things that you know that are work related. That's a great question.
Yeah, and I think that's interesting because Medcall does have a telehealth only service. I don't think ATA has that service at this point, but we do offer a service. So if you're sick, or if it's not a workers' comp claim, we could handle that as well. And maybe Suzy, that's what we talk about the next thing after this. So, okay, so let me go to the next question. Ian, this looks like it's for you. How do you envision telehealth transforming the landscape of workers' compensation in the transportation industry? What impact do you anticipate it will have on driver well-being and company operations?
That's a really interesting question. How do I envision it transforming the landscape? So I have been lucky enough to watch a large transformation of telehealth in general. I'm sure everyone here will remember that little bug that was going around in 2020, COVID. That's when the light really got shined on telehealth. With the encouragement for social distancing and staying at home, regular ailments and injuries were still happening. And that's when people started to discover the benefits of telemedicine, right? So there's that improved access to the care. It's very fast. It's efficient care delivery. It is less expensive because there is no overhead costs for that brick and mortar. The physician can be handling this at home, or if they are in the field in between other visits, these are things that could possibly be handled. It specifically for work comp, I would say that just the streamline of claim management, being able to have access to all of that data captured in real time, seeing what the cause of the injuries are, seeing when the injuries happen even. This is just invaluable information that's being collected. The physicians that are most comfortable with these work comp specific telehealth programs, they just have that enhanced knowledge of the return to work programs, or when time off is appropriate, or even when in-person visits are appropriate. They know when to hand off the reins when it's not something that is able to be handled in over a phone call. But these are things that have already been practiced by these physicians. The future is telehealth. It is quick and it is accessible and it's open for everybody. And this is specifically, maybe I shouldn't have said this is specifically. This is very broad. I said it was broad and then I said it was specific. I apologize. But yeah, that's how I see it transforming.
All right, thank you, Ian. I just want to remind everyone that if you have a question, go to the question section, go ahead and put it in now, and we'll get to it. So Suzy, this question looks like it's maybe for you. Does utilization of telehealth for injuries directly affect premiums? If telehealth is offered as a complementary benefit or employee benefit, can we see a similar impact on comp rates? Is it a factor in quoting? So there's 3 questions in there, Suzy.
These are great questions. So the way, and every carrier may handle this a little bit differently. So I'm just going to speak to how we do this at AT&T. We view the use of telemedicine as no different than if they were to seek an in-person office visit, meaning there was still contact made with an appropriate authorized treating physician, medical care was received, and therefore there's going to be a bill associated with that. When we have people who have used telemedicine, we always say, please get the claim reported. We'll have it set up as a medical only claim. And at the very least, we'll have to pay that one-time bill for the telehealth visit. Again, as we mentioned earlier in the session, there's a contracted rate through Medcall, and so we're going to be having some cost savings there. We would not pay as much for that call as we would for an office visit. Also, keep in mind, more times than not, when you go for an in-person office visit, there's going to be a referral for physical therapy. There may even be referrals for diagnostic testing. Those are things that are never going to happen from a telemedicine call. They're also never going to they're never going to call in any scripts or order any scripts. If the telemedicine doctor feels like any of those are appropriate based on the symptoms that are being discussed, they're going to recommend that the injured worker be seen in person so that somebody can put eyes on that patient and make those recommendations themselves. In terms of how that affects your premium, it just goes into your overall claims cost. And those of us in this industry, especially on the insurance side and those who pay close attention to claims, understand that the medical only claims with a 1 or maybe 2 bills paid for an office visit are not your cost drivers. The claims that are your cost drivers are the ones where they've have significant medical care. For instance, if you go to an emergency room for a superficial type injury and you leave with a $4,000 or $5,000 hospital bill for what could have been resolved in a telehealth appointment instead. Sean, did I touch on everything that was asked?
I believe, did you talk about, is it a factor in quoting?
It's not a factor in quoting. Thank you for that. No, the way that we approach it is that this is just an added feature that's part of our global claims management program. We do not make it mandatory for insureds and member companies to enroll. It's just a benefit here. If you would like to use it, we have it available to you. We do encourage everybody to enroll. There's no guarantee to use it if you are enrolled. So we really just find that there's really no downside in hearing about it and having it available for if and when you ever need it.
Okay, perfect. That looks to be all the questions we have today. I want to thank everyone for joining us today. We appreciate you taking the time out of your busy schedules. If you have any additional questions or would like to get an in-depth demo of the Medcall platform, please contact Suzy or Ian at the contact information below. Again, thanks for joining and have a great day.